Hi everyone and welcome to Health Equity Teachers video on care for veterans. This is the first of two videos in the series. My name is Colleen Wong and let's get started. So here are the objectives for this module. List the demographics of veterans in the United States, describe what the VA system is and how it delivers health care to our veterans, describe health disparities and health issues of importance in the veteran population, compare the substance use and mental health of veterans to that of the general population, discuss homelessness in the veteran population and the efforts to mitigate homelessness in your state, and list resources to address inequities facing veterans. Before we talk about caring for veterans, let's describe the veteran population. This is a figure from Pew Research describing the current demographics of veterans and what they project the veteran population to look like in 2046. In terms of area of service, current veterans have served in World War II, Korea, Vietnam, the Gulf War, and some during peacetime. Of the current U.S. veterans, the majority, or 41% of them, served during the Gulf War era. For VA benefits purposes, the Gulf War period is still in effect. This means that anyone who served on active duty from August 2nd, 1990 to present day is considered a Gulf War veteran. Veterans who served in World War II, which occurred from 1939 to 1945, make up about 1% of current veterans. 5 to 10 years ago, this figure would have been probably closer to 5%. But a lot of the vets who served in World War II have passed away. Veterans who served in the Korean War, which occurred from 1950 to 1953, make up about 5% of current veterans. And those who served in Vietnam between 1955 and 1975 make up about 31%. The era that a given veteran has served in can inform us about possible exposures, trauma, and their needs. Those who are younger than 50 years old make up about 27% of current veterans. Those who are between 50 and 70 make up about 36% of current veterans, and those over 70 make up about 37% of current veterans. White people make up the majority of the racial breakdown of current veterans, and 89% of veterans are male. As you can see on the slide, by the year 2046, there will be a greater proportion of veterans who are younger, part of racial minority groups, and are female. Now let's talk about the U.S. Department of Veteran Affairs and the Veterans Health Administration. The U.S. Department of Veteran Affairs is a cabinet-level executive branch department of the federal government. Its primary function is to support veterans in their time after service by providing benefits and services. The department also has other functions as well that we'll discuss in the next slide. But again, the primary function is to support veterans by providing benefits and services. The department has three main subdivisions, also known as administrations. The Veteran Health Administration, which is responsible for providing healthcare in all its forms, and this includes biomedical research, community-based outpatient clinics, regional medical centers, and readjustment counseling services. The second of such administrations is the Veterans Benefit Administration, and this administration is responsible for the initial veteran registration and eligibility determination. And the third department is the National Cemetery Administration, which is responsible for providing burial and memorial benefits, as well as the maintenance of VA cemeteries. One of the three administrations is the Veterans Health Administration. The Veterans Health Administration is also sometimes referred to as just the VA. And from this point forward, the VA will refer to the Veterans Health Administration. The VA is the nation's largest integrated healthcare system, and it has more than 1,200 facilities. These facilities include hospitals, clinics, community living centers, domiciles, readjustment centers, and others. And it serves about 9 million veterans here in the United States. It was established in 1930 and has since grown to have a $77 billion healthcare budget. The VA can provide medical services, which are reimbursed from other federal agencies, to the general public for major disasters and emergencies declared by the President. The VA is also allowed to provide paid medical care on an emergency basis to non-veterans. The VA is a single-payer system with one budget for inpatient, outpatient, and pharmacy costs. And due to the Mission Act of 2018, care in the community is becoming a bigger priority, accounting for $15 billion in the budget. So now that we talked a little bit about the background of the VA, let's move on to how the VA delivers healthcare. Veterans do not all get free healthcare for life. One big qualification is serving in combat. There are also high priority groups that can enroll for VA care. The priority system is used not only for qualification, but it's used to dictate how much care a veteran is eligible for, what conditions, especially non-service ones, will be treated, and how much care will cost for them, so what their copays are. The VA will cover most of a fully qualifying veteran's medical needs, including women's health services. But there are a few exceptions to coverage. Abortions, IVF, drugs not covered by the FDA, such as medical marijuana, sex reassignment surgeries, and memberships to spas and health clubs are not covered by the VA. Dental care is provided, but it is very limited. In most instances actually, veterans will only get dental care if they have a service-related dental condition or injury. In terms of insurance, veterans do not need to pay a premium, which is the monthly payment for private insurance, but they may need to pay a copayment depending on the type of care, duration of care. Copayments can vary from $8 to thousands of dollars. In general, veterans with the worst service-related injuries are exempt from all or most copayments. The VA can sometimes shift the cost of veterans' healthcare to private insurers. In particular, if the veteran has private insurance and gets treated at a VA facility for conditions not related to military service, then the VA can shift the cost to the private insurer. Sometimes the VA will pay for private care. They will do this in a few separate instances: when some service cannot be provided at a VA facility, when a VA facility is geographically inaccessible, and when a delay in care would cause life-threatening complications. I also wanted to mention that the VA system is not the same as the military health system. This system prioritizes active duty personnel. The military also offers a health insurance plan called TRICARE, which is for active duty personnel. So you may hear people talking about these components of healthcare, but they are distinct from the VA. The VA delivers primary care using the PACT team model. The PACT team includes a provider, so this is an MD, a DO, or a nurse practitioner, a nurse as well, an RN, as well as other staff. Each team member has specific responsibilities, and generally the VA has a much higher support staff ratio than private or public clinics. The VA is also able to deliver specialty care, and they're able to do this through traditional consults, as well as a wide range of electronic modalities like e-consults, telehealth, and integrated programs. The VA also provides mental health care. They have intensive mental health teams to provide different types of counseling and medications. Also, primary care mental health is able to get acute patients in very quickly, oftentimes in the same day, and this is because they reserve most of their day for acute patients. In 2014, the VA was embroiled in a scandal about massive wait times with dire consequences. In the aftermath, Congress and the White House took steps to reform the VA. And the steps included more access to private care, more funding for the VA, and more oversight with less incentives. Now, access looks like a 20-day wait time for primary care or mental health and a 28-day wait for specialty care. Veterans are now eligible for urgent care in the community, made possible by the Mission Act passed in 2018, and the VA is also defining access more broadly. This includes virtual care modalities such as video visits, phone visits, and email. Now let's talk about health issues and health disparities that veterans face. Hearing loss and hearing problems are common among veterans. Tinnitus is the #1 disability among veterans. And there can also be traumatic brain injury that causes sensory problems that leads to hearing loss and hearing problems as well. The VA uses the term military sexual trauma to refer to sexual assault or sexual harassment experienced during military service. An estimated 1 in 4 female veterans and 1 in 100 male veterans in the VA healthcare system report experiencing military sexual trauma. It's important to note that by percentage, women are at a greater risk of experiencing military sexual trauma, but nearly 40% of veterans who disclose military sexual trauma to the VA are men. Agent Orange is an herbicide and a defoliant chemical used by the U.S. military during the Vietnam War. And afterwards, Agent Orange exposure has been associated with diabetes, heart disease, respiratory cancers, prostate cancer, Parkinson's disease, birth defects, leukemias, and lymphomas. In terms of hepatitis C, more than 5% of U.S. veterans are infected with chronic hepatitis C, which is triple the rate of the general population. There was also found to be groundwater contamination at a Marine Corps base, Camp Lejeune, from 1950 to the 1980s. And in 2014, the CDC found that the contaminated water increased the risk of leukemias and lymphomas, Parkinson's disease, and cancer such as kidney, bladder, and liver cancers. The Gulf War syndrome is a cluster of medically unexplained chronic symptoms that can include fatigue, headaches, joint pain, indigestion, insomnia, dizziness, respiratory disorders, and memory problems. And these illnesses, in order to be considered part of the Gulf War syndrome, must have appeared during active duty in the Southwest Asia theater of military operations. And lastly, some of the most common orthopedic conditions or orthopedic injuries from service are degenerative arthritis, patellofemoral syndrome, degenerative disc disease, fractures, and shin splints. Now let's talk about mental health disparities. Many veterans are not appropriately screened for PTSD or other serious mental illnesses after serving. This leads to nearly 20 veterans dying from suicide a day. Veterans had a higher prevalence of serious mental illness compared to non-veterans. And female veterans had a higher prevalence of past year major depressive disorder compared to female non-veterans. However, veterans do not have increased substance use disorder issues. Among all adults, the prevalence for illicit drug use was lower for veterans compared to non-veterans. And the rate of use of marijuana, non-medical use of psychotherapeutics, non-medical use of pain relievers, and hallucinogens, those rates were also lower for veterans compared to non-veterans. The VA, and specifically the Office of Mental Health and Suicide Prevention within the VA, is always striving to prevent veteran suicide. The suicide rate for veterans is 1.5 times higher than that of the general population. And comparing the rate among female veterans to non-veteran adult women, the rate is 2.5 times higher. Suicide rates are also especially high among older veterans. According to the VA, in 2016, about 58% of all veteran suicides were unfortunately committed among veterans who were aged 55 or older.